Welcome, 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 welcome to Ageless Intimacy. Y'all just caught us coming in, y'all, and we already lit, crunk, and ready to have a good time tonight. Thanks so much for joining us. Go ahead and let everybody know we are live. So good to see you, Dr. Mia and Joseph, in this
What
new
up?
year.
Happy New Year.
Happy New Year to everybody.
Yes.
Intimacy
Yes.
with Dr. Mia and Joseph in 2025.
We are so happy.
I
to be
love
here.
it. This is our inaugural.
Yes,
This is our
absolutely.
inaugural 2025 Ageless Intimacy. Listen, we were talking before we came live, and you know what? There is so much going on already in this year. We got to figure out a way to just laugh at some stuff and have a good time
Right.
to make this a better year. What y'all say?
Yeah.
Well, I say this is a year we better trust God.
You
That's what we learned at church today.
church.
You better
Now
trust
you
God.
can turn this into church. You are
Yeah.
absolutely right. We're gonna need all the faith we can find.
They about to put their faith in the works because it's gonna be a
We
great
gotta
year.
find.
I can see
Yeah,
it's a great year. It's
Yeah,
gonna be a
and
great
2024 was not a bad year. It was for some people, but
It
you
really
know,
was for me.
and,
Yeah.
and some people went through a lot of stuff, but at the same time, you got to count your blessings just to make it on this side of January 1st. You got to count your blessings, because a lot
I
of people
agree.
didn't. A lot of people didn't
I
make it.
agree.
So,
And you know,
so
we go through this. We go through this every year. Well, a lot of people don't make it, and then we
yeah,
get here and we get all excited, but then life starts lifing, and so we
yeah,
got to figure out a way how to keep not just what we're going to talk about tonight, our hormones balance, but our life balance,
Yeah.
because
right.
that's what when your life is out of sync and out of whack, it just causes everything to be bad or a hardship. But anyway, we're gonna get in it, but before we get into all of this good stuff we're gonna talk about tonight, Dr. Mia, Joseph, just give us a little short intro of yourselves.
Okay, I am Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as hormone pellet therapy, weight management, intimacy solutions, laser hair removal, and total wellness with supplements to both men and women. Our goal is to
Who
help
does it all?
you live well, age well, and experience everlasting intimacy. Dr. Mia.
Yes. And every Batman gotta have a Robin. So
And I'm just Joseph.
Robin Joe.
I'm just Joseph.
Tell them who you are, baby.
I'm Joseph.
You is important. You're more important than Joseph.
You is important.
You
You
is
is kind.
You is smart.
You is
I
smart.
love it. I love it.
But she said all the right stuff. I'm Joseph's male intimacy coach for Me Bella Wellness.
I love it. I love it. It looked like you've been had a little inebriation in because your tongue got tied up.
Yeah, honey.
I literally just ran in the house.
He
Like,
just got in the house
20 seconds ago.
They had club meeting today.
Club
Oh
meeting.
my God, club me.
Club meeting ain't
It's a
over,
lot of
so
that going on out.
I'm going back to the club meeting.
And I had my own club meeting.
Yeah, she had her own club meeting.
I see your club meeting cup.
Right.
Right.
Well, listen.
We got water.
Okay, well, you better chase it. Everybody need an old chaser. I'm super excited about this year, real talk. Last year was a very challenging year for me. Some things I experienced through a medical situation that just literally knocked me off of my rocker. And, I think it'll be a good sort of segue because there are so many people who experienced challenges on last year. So I want to talk a little bit about how we can overcome that in this new year through our hormonal, revival and really getting in a healthier place mentally and emotionally. Now, and I want to say this, and I don't mean no disrespect.
And spiritually,
we ain't gonna never leave that out. Yeah. But I want to say this because I said to some friends of mine, last year seemed like it was the year of mental illness. And so I want to ask you, what is your suggestion to us on how to, because everybody making New Year's resolutions and trying to stick to them right about now, but in a minute that'll be over. But what do you say about, us wanting to make some lifestyle changes?
I would say focus on balance, like you started this off with balance. So stress reduction. So making sure you know, getting some kind of exercise in, seeing your therapist on a regular basis. If you haven't seen your therapist in like a year, go ahead and schedule your appointment. If you don't have a therapist, go ahead and start seeking a therapist. And then making sure you have that time for stress reduction. You know, your hot baths in the middle of the day, being on more of a schedule, just things that you can do to make your life easier, paying for some things. You know, if you don't have time to clean up your whole house every day or every week, getting help when you need help, and then trying to organize your schedule to reduce stress. Because I think everybody has been, if nothing else, if people had a great year in 24, I think it still was a more stressful year for most people.
It really was. It was a very stressful year. And I'm going to tell you something, because we were dealing with all of the political stuff. It just really took a toll on people. It was one of the most exasperating years. OMG. And so, okay, you just said something that's really, really good. And I don't know if I've ever heard that phrase, stress reduction.
Mm-hmm. Absolutely. I think some of the things that we have to do is, you know, we set these resolutions, right?
Right.
Doing that because I think it's really important that you just be a better person, a better you. You know, be better, just be better. Whatever you did last year well, do it better this year. And whatever you didn't do that well, try to increase on that and being better in that. So just being better. If you started working out last year, let's start working out more. If you started focusing on your mental health, let's focus on it more. If you started, you know, working on your finances, let's be better on your finances. Mm-hmm. You know, I want to be healthier. I want to be a better husband. I want to be a better father. I want to be a better CEO. I want to be a better person in general. So I think, you know, and I think the most important thing is just to be better, you know, because last year wasn't easy. I think we learned a lot last year, you know, mm-hmm. But, you know, even with the new political administration coming in, you can't focus on the administration, because last time I checked, our mortgages still due, gas still due, electric still due, car notes still due, insurance still due, tuition is still due. So everything is still due. You know, the best thing you can do is try to work within the system, whatever they provide for you. Yeah, you know,
absolutely. But and that's a good point, Joseph. To work within it. To work within it, because you're not going to change it by moping or being stressful.
You wasted energy in the wrong direction. Right. You want to put that energy into the good direction. Yes. You know, we know who's going to be president. Yeah, okay. We dealt with that for 4 years. Right. You know, we know what it's going to be.
If you Black
so how are we going to be better within that system?
Right. What can I do personally?
There's going to be some loopholes. I just think we find the loopholes. You know, so let's figure it out.
Mm-hmm. I just think one of the best things you have said, and you say a lot of great things, Joseph, but you said, how are we going to work within that system?
Right.
And I think that's and let me go here. I think that's where we miss it when it comes to our health and wellness, when it comes to our weight management. A lot of people are eating. I know for a fact that stressful eating is real.
Yeah, it's emotional eating is real.
Yeah. Because I went and bought me a big old jar of pickles from the
Well, that was better than a big old jar of cookies, I tell you that. Now,
maybe I went and got them pickles we used to get for $0.25, Joseph.
Yes, I love them.
From the corner store.
The big crunchy one.
Oh, my goodness.
And you remember they used to like take them out, the person who was working the cash register and touching all the money, they used to put the little thing in there and pick it up.
Get it. Sure enough. Juice just dripping all in the brown paper bag.
What you calling for now?
And then it was the pickle pig feet right next to that. Remember, because they used to be pickle pig feet and pickles.
I'm from up north.
We from Birmingham, Alabama.
I'm from up north.
You have no idea, Joseph. The big jar pickle pig feet was right by the pickles. And they used the same fork for both of them.
Yeah. And nobody washed their hands
nobody washed their hands. And we didn't have no sanitizer and no COVID.
And they probably didn't have a sink by them to wash their hands anyway.
They didn't. None of the health codes were honored at the blind man store.
At the handy pack.
At the handy pack.
Right.
Or at Miss Annie's house. And I ain't never seen Miss Alice with no gloves on to give me my cookies. She just went straight in the bucket and put them in my bag.
And while she's making your freeze pop.
Yeah.
At the same time, you got water out of a
hose pipe.
Hose pipe.
Yeah. So, yeah. Okay, yeah, we got way off. So
no. I think we are right where we need to be. We're talking about weight management, and I said I really started this binge eating because so many things were happening around my personal life. Yeah. I was trying to find a way to pacify without really hurting myself. 100%. Talk to me, Dr. Mia. I need you and Joseph to be my therapist and counselor tonight, along with our listening audience. How do we deal in seasons? Because now we can get in front of it, of challenges when it comes to our eating.
I would say planning is going to be key. Because the biggest thing is being able to cook at home, have food readily available so that you don't have to make choices and decisions about what you're going to eat. So what we have been doing is going to the store and kind of getting a couple of meats for the week. Look at her, Eminem.
Send me some.
Now you're wrong even buying that big old thing.
And you've been eating them too.
But I would say the planning part, the meal prep part of it, you know, and then keeping you some healthy snacks, because you may get stressed out, and like I do get stressed out in the eating, but I just have a different way of doing my snacks. I may have some smaller pieces of candy where I can just have one piece of chocolate, you know what I mean? Or I may keep me some popcorn for the salty craving. I may do a pickle, because pickles don't have a lot of calories in them. So I may do something like a pickle. I do a lot of hot tea now. And I have hot teas from Reality, where I can actually get a tea with ashwagandha in it that actually relaxes me, that I can order offline. And they're like loose leaf teas. They have one, you know, have them for everything that you can think of. Energy.
And what is that? I got to write that down for our audience.
Reality. FREEALITEA. And I put it in the comments. But yeah, she has excellent teas. But I think hot teas are a great way to actually deal with the whole emotional eating component, because it's something hot, it tastes good. You can put a little honey and agave in there so that it, you know, it has a good flavor, and you can pick some flavorful teas, and that's a good way to kind of deal with your emotional eating. You're still doing that whole thing where when you feel bad, you're used to putting something to your mouth, but you're putting something without as many calories and out of sugar and out of processed stuff.
Right. So
and I think another thing too for the emotional eating, I think if you're going outside the home to satisfy yourself, besides eating something in your home, and I'm not talking about M&Ms with peanut M&Ms, which you need to send me some, but if you're eating in your home, what we found over the holidays, especially, you know, it's a whole month of holidays, like, you know, Thanksgiving lasts the following week. And then we start, you know, and then
it carries over.
And then you have Christmas parties and all that stuff.
Right.
What we realized this year is we've eaten mostly in our home throughout that whole month between Christmas and Thanksgiving and years. So we've eaten mostly in our home. So we did gain some weight, but we didn't gain the weight we usually would gain.
Right. Right. Just from that.
Now that we get back on our grind tomorrow, you know, it'll be easier for us to lose the little weight we did gain. But because we didn't eat fast food, because I'm gonna be honest, I've been craving a Whopper with cheese, no tomatoes, cut in half with bacon. Cut in half with bacon, you know.
A 0.5.
Right. You know, cut in half with bacon for the last month. I did get one time. But you know, but at the same time, I was like, no, I'm going home to eat. A lot of times I just said, I'm gonna go home and eat. I'm gonna go home and eat. I'm gonna go home and eat. And that has everything to do with managing your weight. It's okay. I mean, during the holiday seasons, what I suggest is you work out more that month before holiday season.
And I would even go as far to say is mindfully eating.
Yep.
So really paying attention to what you're eating, what it looks like, what it smells like, how it makes you feel. And then you tend to not crave some of the bad stuff, because you realize that that's what's making you feel bad. You know, after you eat a whole bunch of sugar and you do a Red Bull with some caffeine in it, you just feel good for like 20 seconds, and then
you crash.
Horrible.
Crash,
and then you start having headaches, and then you realize you're dehydrated. So I think mindfully eating, planning and prepping, and then making it a choice to try to eat at home and have control of what you're putting in your mouth as much as possible.
100%.
So Dr. Mia, there's somebody watching right now, and I know exactly what they're saying because I'm prophetic. They are saying all of this is too expensive. It's too time consuming. I got kids. I got a job. What are you going to say to that person?
It's more expensive when you turn 70 years old and somebody got to take care of you.
45, baby. These people are coming in with heart
I'm talking
disease.
people in my age group.
But I'm just saying, it's people as young as 35.
Oh, yeah. You're absolutely right.
All of these chronic diseases at a much earlier age because we are fast food children.
But then if you become enabled to take care of yourself, that is really expensive.
Yes. Or having to go to the doctor all the time because you got chronic disease. They want you every 3 months to get your repeat.
You're right. You're sure right.
So
I myself am.
It's best to take care of yourself. That's it. It's best to take care of yourself
invest now or invest more later.
It's going to cost you or cost your family.
So tell me because I think I kind of saw Joseph doing this one time. Tell me what prepping your food looks like. Like, what's that system like?
It can be real simple.
Yeah. So what we do is we try to think on Saturday and Sunday what we're gonna eat for the week. Because food spoils so fast these days,
and it's so expensive.
You really can only buy your food every week,
right?
So we try to figure out we freeze some stuff, but we try to figure out what we're gonna eat this week. Like, so we ate a whole bunch of bacon and pork over the holidays. Like, we baking out. So we taking it easy on the bacon because I noticed my hands were getting a little tight and stuff like that. And they got a little
and the weight was going up.
Yeah. So we taking it easy on the pork for the next month. We're doing chicken, turkey, fish. The only thing we haven't gotten is some fish. So we're gonna go by the fish market on Thursday when we done the challenge. But we turkey, fish, and we're just gonna cook in the house.
Yeah.
And we try to cook on either Sunday or Monday, and then that should last us like the Wednesday, and then try to cook again Wednesday or Thursday. We may get something out one time during the week, but we really want to eat in the home.
Yeah.
Yeah. Whatever we cook, we really want to eat.
Back in the day, our parents, I know, had the opportunity to meet your mom, Joseph. Our parents, their food prep was a pot of soup or spaghetti or some kind of casserole.
We had chili last week. We had a pot of chili last week.
Turkey made with ground turkey.
Ground turkey.
Yeah. It was flavorful and delicious.
It was really good.
Yeah.
Like we bought a rotisserie chicken from Sprouts.
Yep.
So we got the rotisserie chicken, and I made a salad today.
Yep.
And then we still had some other chicken, and then we had like a piece of pizza left from the weekend. You know what I mean? So like everybody can go in there and get them a protein and some vegetables, and we have eaten dinner for today.
Right.
We cooked breakfast at home instead of stopping like we used to do after church.
Right.
We would go to a restaurant and spend $150 with our mimosas and our food and have a good time. But we came home and Joseph cooked eggs and grits and chicken sausage and turkey bacon with sourdough bread, and it was absolutely delicious. But we cooked it at home, and it tasted better than anything we could have gotten out. So I think it's just a matter of getting the mindset to just go to the grocery store and plan, because you can't go to the grocery store and cook on the same day. So go to the grocery store when you have your free time, and then have it ready and have an idea of what you want to cook and prepare.
Right.
So we're talking about weight management and hormonal balance or hormone balance, right? And one of the things that I think is I won't say it's one of the things, but it's very challenging when it comes to a busy lifestyle. And what you said earlier was literally being mindful. So family, what you have, what your responsibilities are. But your health is just as much a part of that.
Yes.
Or if I guess you would say, Dr. Mia, it's probably the most important part of that.
It really is.
If you're not healthy, you can't take care of kids. You can't take care of the husband. So managing your weight is not just about looking good in them jeans.
Right. It's about
living long and healthy.
That's right. Decreasing your risk of disease and high blood pressure, and not being on 3 blood pressure medicines, but maybe just 1, because you still may be on 1. You know what I mean? Not having to be on insulin for your diabetes, and maybe you doing it with your diet because you eating healthy and you exercising. And then just putting those things in your schedule. Like, we have to put in our schedule on Sundays or Saturdays. This is what we do. On Monday, I know on my schedule, I have everything that I need to do, all my meetings, everything else. So at the bottom, if I'm supposed to cook a meal, I need to put that on my calendar. So just kind of putting it and making it a part of your life, and then chipping in even at stuff you're not good at. I'm not good at cooking. Both of us don't, neither one of us have time to cook. So it's not fair for me to say I'm too busy to cook. So now I figure out a meal that I can make per week. Joseph can make a meal per week, and that's enough to get us through between a rotisserie chicken, our leftovers, and some salads and stuff. But everybody feels better because we're eating healthier.
Well, okay, eating healthier, because my menu was totally different than y'all's today. I want to know how you can tell me. Well, I did have turkey legs.
Okay.
I did have turkey legs. I had turkey legs. I
smoked them, or you smothered them in the.
I crock popped.
Oh, so that's good.
Yeah, absolutely.
But I cooked field peas and snaps, pinto beans, macaroni cheese, candy yams, cornbread. I did some all kind of other foolery, but
you called us before now.
But what I want to know is because I'm really trying to do more vegetables, more. So have the plate full of, and we are really fond of the whole turkey family.
Yeah.
So would you say eating more turkey, more fish?
Yep, the chicken,
better.
turkey, fish, and seafood. Those are going to be your better options as far as high fat when you're thinking about heart disease and decreasing your blood pressure and that sort of thing. And then baking it and sauteing it and putting it in the air fryer rather than deep frying stuff.
Correct.
Smoking, grilling, that's going to be your better option. And finding a way to make your meals as colorful. Baking, and then finding a way to make your meals colorful. So like for my salad today, I had red peppers, green peppers, yellow peppers, cucumbers, the different colored tomatoes, the different kinds of lettuces. And then I put my little, almonds and stuff. But I'm saying you can make stuff healthy. That's just normal stuff. And you just add you more vegetables and that sort of thing.
Because that's the big deal right now. Just really going in on the vegetables, huh?
And then when you don't have enough nutrition and you have bad nutrition, you get sick. So the people who eat fast food all the time, they always got a cold. They always got some kind of ailment. They always at the urgent care center because they got some kind of immune thing going on. People who have uncontrolled diabetes. So just eating healthier and getting your nutrients in, taking your supplements, taking your vitamins, all of those things are going to help you to be just healthier and feel better,
Yeah. And I'm going to tell you right now, ladies and gentlemen, we got a big back epidemic going on right about now. I'm talking about the wide load is getting wider.
No, they thick.
No, baby, that's baby, boxy, full out 18-wheeler backs. No, we have got to do better, people.
It's killing us. It's literally killing us.
It's really killing us. And I don't care how cute you try to put it. It's serious.
Yeah, it's the same as smoking cigarettes. Like you smoking cigarettes and it's going to give you lung cancer.
Right.
You're overeating and you're okay and making up excuses why it's okay for you to be obese, knowing that it's going to kill you, because the number one cause of death is heart disease. If you're overweight and obese, you're more likely to have high blood pressure and heart disease and diabetes. So, I mean, it's literally killing us by making these bad choices.
And you know what, Dr. Mia, we all of us travel abroad. And one of the things that I heard on CNN this past week was the food or even the commodities that we have. I'm sorry, the condiments that we have here in America are poison. Yes, their ketchup don't have the stuff we have in there. Their syrups, we have literally been given deadly food.
Right, deadly poisonous food.
It's made for you to be addicted.
And more, and you have to eat more food with terrible food. When you eat McDonald's, you're hungry in 2 hours.
Gee whiz. So we're talking about getting healthy, people, in more than just one way, not just through exercise, but your diet, your mental wellness, getting those hormones balanced and in sync. I can tell you right now, when I came to Dr. Mia, I was a cuckoo for Cocoa Puffs. And when your hormones are off, and I haven't been in a minute, I know I'm already been. What is it y'all put me on the list every 6 weeks?
Right.
The compliance.
The non-compliant list. The callback non-compliant list.
I was praying the other day, like, Lord, please don't let Dr. Mia kick me out. Jesus, please show up my heart.
Tan call you this week. Tan will give you a call this week.
Okay, I was like, Lord, please don't let her kick me out. Let me tell you something about Me Bella people. They are a for real, sincere group of people who really care about the patient. I'm telling you, Me Bella cares about the patients. And I'm talking about her staff follows up. They want to make sure, are you sure you're not coming? Are you coming? I'm like, who auntie is this that keeps calling me to come to the doctor? But I want you to put some information in the chat so that they'll know how to connect. Because there are so many programs Dr. Mia have for these specific matters. Your health, I'm talking about your
health, your weight
management, your hormone health, and your weight management. Dr. Mia, talk a little bit about some of the product you offer in both of those areas.
Okay. So like for hormone health, so if you're starting to notice night sweats and you're starting to notice that you're gaining weight and your belly's getting a little bit bigger, you're tired all the time, you can't sleep, you don't desire physical intimacy, you don't enjoy physical intimacy, you're starting to be more irritable, depressed, or anxious, you can't focus and remember, you're having hot flashes during the day, all of those things are signs of hormonal imbalance. So the first thing you do is schedule your appointment as a hormone consult or a gynecology menopause consult. Then you can use your insurance or not. And then we're going to do blood work. We're going to get a good history and we're going to figure out a treatment plan that's going to work for you hormonally. And then if it's the weight management component, we do the same thing. You come in for that consult. We're going to do your resting metabolic rate test, figure out exactly what you need, look at the real science of it. And then we're going to do some behavior modification and accountability and coaching. And we're going to come up with a plan, again, that works for each individual person because everybody's lifestyle is different. Everybody's body makeup is different.
Right.
Everybody's habits are different. Everybody's lifestyle is different. So we customize a plan specifically for each individual based on what they need so that they can be successful at their weight management, their total wellness, their hormone balance. We make sure you're getting your prevention and your screening so that you can live your best life.
Look, Dr. Mia, you done turned Joseph clean on with all that intelligence. He was just railed back and, hey, let's cut the tape. He was intrigued with all your medical ability. All right, yeah. Joseph.
And it's Sunday night, so you know what that
means. Yes.
Date night. Date tonight. We got a date.
I'm about to get back into the streets.
I'm done. Ageless Intimacy with Dr. Mia. Hey, they say it's about to snow, so you need to sit down somewhere.
I'm from Wisconsin. Snow don't scare me.
You can have it.
It's curfew. It's past 8:30.
I ain't got no curfew. I'm a real grown man. She crazy.
Hey, you got
he passed.
You can out that door if you want to, cool.
I'm bold enough to be her big brother.
Listen, what I want to say, I'm super excited. Oh, no, call him Uncle Daddy.
Uncle Daddy.
Y'all remember back in the day when our mamas or aunties or somebody you knew used to have men coming over and we would call him uncle. I'm like, why he my uncle? Is she your brother?
Whose brother is he?
I was too smart for that foolishness. Quit playing.
Reunion?
Yeah, I ain't never seen him at the family reunion. Right. I was a kid that always get my mouth knocked off because I had too many questions.
Yeah.
So listen, if you have any questions about your health or your hormones, you can always reach out to Dr. Mia and Joseph at mebellawellness.com, or you can call the office and make an appointment at 205-995-1009. Listen, it has been very good tonight. To know we got to eat better. I got to get off these M&Ms and pickles, and we got to get some more chicken, some more fish,
and
turkey,
and seafood and vegetables,
veggies,
and
good old
vegetables,
green beans and salads
and water,
spinach and kale and water and fruit.
Because it's the holiday season, so y'all been taking vodka and bourbon and tequila for the last month. Y'all been drinking all that stuff.
Your liver needs a break.
Right, it's time to detox.
I start my break tomorrow.
Yeah.
Look, I'm starting my break tomorrow.
Start to detox tomorrow.
But look, y'all, Miss V, I want you to give us an update on what you're doing, and I want everybody to remember that we have the Weight Management Challenge starting on tomorrow. It is free. It's at 7 p.m. Central Standard Time. Go to the website, mebellawellness.com. You can click on the link to register. Right. I'll be talking on Monday at 7 o'clock, Tuesday at 7 o'clock, Wednesday at 7 o'clock, and we have a special VIP day with my super friends on Thursday. So it's going to be great information about mindfulness, mindset, as well as all of these different techniques that we can use to lose the weight, the behavior modification. And we're also going to talk about the new medications out here that are helping people to lose the weight as long as you're using them correctly.
Yes.
Yeah, with Wegovy, all of those things work well if you're doing your part. And that's the big part that everybody's missing. They're taking the medicine, but they're not changing their lifestyle so they can lose the weight and keep it off.
I want my medicine to work through my chicken.
The fried one too.
Do my medicine work through peach cobbler? Give me the Wegovy that go along with peach cobbler, macaroni and cheese.
Well,
that's what some people doing though, so that's why.
No, that's what they think they can do.
Right.
These are not long term. These are not long term. Medications.
It's something you do.
Right. For the individuals who have like diabetes and things like that need them daily, yes. But these are not long-term weight loss solutions.
Right.
No, they're not. No, they're not.
They're real long-term.
They can help you get started, but you have to.
And then you got to build up. Yeah.
And you use them to help you change your lifestyle.
Yeah, exactly. That's the key.
Appetite down and things like
that.
That's
the key. That's the key.
So y'all come to the challenge and y'all can learn everything you need to do so you can live your best life. Miss B, what you got going on? Where you
Girl, I decided I'm gonna go start stripping at Magic City on Thursdays.
Girl.
I'm gonna strip at Magic City on Thursday, the Volcano on Friday. No. We got the Epic Center on 3rd Avenue West, and it is a rental facility. You can rent it for all of your special occasions. If you are having a baby shower, a wedding, a reception. We actually just had a wedding and a reception. It was amazing. It was beautiful. Yeah,
great venue.
Yes, we do. We have 11,963 square feet. Oh. If you need more information on how to rent the facility, you can always call me at 205-212-0399. That's about all right now. Just really pouring myself into the Epic Center and trying to get it built up.
Because y'all did it. The Epic Center opened in 2024 or 2023?
2023.
2023.
And what was the date?
We opened it. We did our grand opening in August.
Okay, so y'all over a year in now and doing well.
And I'm super grateful about what this year is going to bring. My son is coming home from New York, who is in movies and theater. He said he is going to commit to coming home to really help building up the arts perspective. Then my other son that's in Italy, been performing off Broadway, will be home in 3 weeks. And we are already working on a project called Flesh. Oh my God.
Let Marlon know, I got a little act over here.
I know. We're going to have to put Marley on the stage, but Dominique is coming, so Marley is going to love him. Wait till y'all meet him. When you meet him, you're going to he knows his stuff.
Yeah,
the boy is star.
Broadway.
Mr. Broadway, yes. And then he's in Kingdom Business. He called me and asked me, Mama, did you watch the finale yet? And then he said, they put words in my mouth I didn't even know I had. I said, okay, I'm going to watch it. So he's also in that. And he's getting ready to film. He just got a role in a movie that Denzel Washington's son is producing. So we're really excited about some of the arts that's getting ready to take place at the Epic Center. March is going to be a big month. Bonita the Bag Lady, where I play 8 characters, is a one-woman show, is coming back in March. And so, in May. And so get ready.
I was going to say, because you got an event on March the 15th. the intimacy
Boom.
with Dr. Mia. So
I already know. Look. Shots fired. Boom.
Look,
I got it.
Mrs.
I
B.
got it. Super excited about that too. And Dr. Mia, I literally, and I know we're live, but I've been talking to a lot of people about your services and who you are. And there's been so many people who don't know you. So I want to do an event called Meet Dr. Mia and Joseph. And it's just going to be a mingler. But what we're going to do is put people in the room that can really hear what you all offer, because there's a lot of people who don't know. You can fix yourself with just a hormone balance.
Yeah.
But people need good gynecology services.
Right.
Exactly.
Women good doctor who cares about you. Good
nurse. That's the point.
There is a real disparity.
Yeah, it is.
There's a real health disparity. So people need providers that's going to tell them the truth and give them options, good options on their health.
And all options so they can make their own decisions about their health and their body.
Right. And
I'm sick of trying to tell them what Dr. Mia told me. Go get you an appointment.
205-995-1009. And you know what? You can make appointments online. You don't even have to call. You can go make one right now. Gynecology, management, whatever you want. Yeah. So Happy New Year, y'all. We are so excited to continue to bring Ageless Intimacy with Dr. Mia and Joseph. One of our major goals at Me Bella Wellness Center is to educate the community, and we want you to know how to live a healthy lifestyle so that you can live your best life. We always appreciate Miss V for coming in and helping us to get the information to everybody. Don't forget about the challenge. Don't forget, save the date, March 15th, our big intimacy event, one that has never been had. There has never been an intimacy event like the one we're having in March, and there's never been a weight management challenge like the one we have starting tomorrow.
Right. The weight management challenge, Monday, Tuesday, Wednesday, and Thursday.
That's right. 7 p.m. Central Standard Time. Go register. Thank you, Mrs. B.
Thank you so much. I really appreciate you all.
Send you all your dates, girl, so we can keep it going.
All right. Well, y'all tune in the next time until we meet again. Go have a healthy week.
Bye, y'all. Live well, age well, experience everlasting intimacy. Bye.